Non-health-related revenue raisers. Corporate information reporting. Businesses that pay any amount greater than $600 during the year to corporate providers of property and services would have to file an information report with each provider and with the IRS effective for payments made after December 31, 2011. Codification of economic substance doctrine and imposition of penalties. The economic substance doctrine is a judicial doctrine that has been used by the courts to deny tax benefits when the transaction generating these tax benefits lacks economic substance. The courts have not applied the economic substance doctrine uniformly. The manner in which the economic substance doctrine should be applied by the courts would be clarified and a penalty would be imposed on understatements attributable to a transaction lacking economic substance. These changes would be effective for transactions entered into after the enactment date.
Elimination of credit for unprocessed fuels. A $1.01 per gallon tax credit applies for the production of biofuel from cellulosic feedstocks in order to encourage the development of new production capacity for biofuels that are not derived from food source materials. Congress is aware that some taxpayers are seeking to claim that cellulosic biofuel tax credit for unprocessed fuels. For fuels sold or used after December 31, 2009, eligibility for the tax credit would be limited to processed fuels, i.e., fuels that could be used in a car engine or in a home heating application.
Estimated taxes for large corporations. The required corporate estimated tax payments factor for corporations with assets of at least $1 million would be increased by 15.75 percentage points for payments due in July, August, and September of 2014.
Other tax changes.
Simple cafeteria plans for small businesses. For tax years beginning after 2010, a new employee benefit cafeteria plan to be known as a Simple Cafeteria Plan would be established. This plan would be subject to eased participation restrictions so that small businesses could provide tax-free benefits to their employees. It would include self-employed individuals as qualified employees. Liberalized adoption credit and adoption assistance rules. For tax years beginning after December 31, 2009, the adoption tax credit would be increased by $1,000, made refundable, and extended through 2011. The adoption assistance exclusion would also be increased by $1,000.
New credit for new therapies. Effective for expenses paid or incurred after December 31, 2008. In tax years beginning after that date, a 2-year temporary credit would be created, subject to an overall cap of $1 billion, to encourage investments in new therapies to prevent, diagnose, and treat acute and chronic diseases. New exclusion for certain health professionals. Payments made under any state loan repayment or loan forgiveness program that is intended to provide for the increased availability of health care services in underserved or health professional shortage areas would be excluded from gross income, effective for amounts received by an individual in tax years beginning after December 31, 2008. A separate provision would exclude from gross income the value of specified Indian tribal health benefits, effective for benefits and coverage provided after the enactment date.
YourOnlineProfessor.net presents the Patient Protection and Affordable Care Act, Non-Tax Provisions. Introduction. The Patient Protection and Affordable Care Act will ensure that all Americans have access to quality, affordable health care and will create the transformation within the healthcare system necessary to contain costs. The Congressional Budget Office has determined that the Patient Protection and Affordable Care Act is fully paid for, ensures that more than 94% of Americans have health insurance, bends the healthcare cost curve, and reduces the deficit by $118 billion over the next 10 years and even more in the following decade. Quality, affordable health care for all Americans. The Patient Protection and Affordable Care Act includes immediate changes to the way health insurance companies do business to protect consumers from discriminatory practices and provide Americans with better preventative coverage and the information they need to make informed decisions about their health insurance. Uninsured Americans with a pre-existing condition will have access to an immediate insurance program to help them avoid medical bankruptcy, and retirees will have greater certainty due to reinsurance provisions to help maintain coverage. New health insurance exchanges will make coverage affordable and accessible for individuals and small businesses. Premium tax credits and cost-sharing assistance will help those who need assistance. Insurance companies will be barred from discriminating based on pre-existing conditions, health status, and gender. A substantial investment in community health centers will provide funding to expand access to healthcare in communities where it is needed the most. The role of public programs. The Patient Protection and Affordable Care Act expands eligibility for Medicaid to include all non-elderly Americans with income below the 133% of the federal poverty level, with substantial assistance to states for the cost of covering these individuals. The Patient Protection and Affordable Care Act maintains current funding levels for the Children's Health Insurance Program for an additional 2 years through fiscal year 2015. Enrollment in Medicaid, CHIP, and insurance exchanges will be simplified to allow easier access. Improving the quality and efficiency of healthcare. Congress is committed to protecting and strengthening the Medicare program for America's seniors. Medicare is a sacred trust with seniors and people with disabilities, and the Patient Protection and Affordable Care Act will ensure that the trust is preserved. The cost of inaction is unacceptable for seniors and the Medicare program that serves them. Without action, the Medicare Hospital Insurance Trust Fund is expected to go broke in just over 7 years. The Patient Protection and Affordable Care Act will make Medicare a stronger, more sustainable program. Medicare currently reimburses healthcare providers on the basis of the volume of care they provide rather than the value of care. For each test, scan, or procedure conducted, Medicare provides a separate payment, rewarding those who do more, regardless of whether the test or treatment contributes to helping a patient recover. The Patient Protection and Affordable Care Act includes a number of proposals to move away from the a la carte Medicare fee-for-service system toward paying for quality and value and reducing costs to America's seniors. Preventing chronic disease and improving public health. The Patient Protection and Affordable Care Act promotes preventative health care and improves the public health to help Americans live healthy lives and help restrain the growth of healthcare costs over time. The Patient Protection and Affordable Care Act will eliminate copays and deductibles for recommended preventative care, including preventative care for women, provide individuals with the information they need to make healthy decisions, improve education on disease prevention and public health, and invest in a national prevention and public health strategy.